I'm Allison Musser. I will be presenting on dengue virus. I'm going to start with some key characteristics of the virus. So it is the cause of dengue fever. It's a vector-borne disease and it infects up to 20,000 U.S. citizens per year. It thrives in tropical and subtropical regions. It's really common among travelers returning from Latin America, the Caribbean, Southeast Asia, etc. And these people will commonly bring it back to their home states in the United States. And on our map to the right here, we can see that below the equator in our tropical and subtropical regions, it is the most common. Some more key characteristics. The virus is in the Flaviviridae family. It's spread through an arthropod vector, and humans are the only host for this virus. It has a single-stranded RNA genome, which encodes for a single polyprotein that has many transmembrane cleaved domains. To our left here, we can see a picture of the virus. Now for the genetic information. It's believed that humans and dengue virus have evolved alongside each other. Because humans are the host, it has used our entire genome sequence to change in terms of diversity. And research has shown us that serotype shifts occur alongside clade replacement. It's pretty typical for a plasmid to encode for an envelope protein. It will neutralize antibodies, and this is involved in its protection. This is common among viruses. But this is significant because it's able to slow our immune response. At a molecular level, the plasmid neutralizes antibodies in the NS1 sequence. For the symptoms and severity, we already know that the virus causes dengue fever, and severe cases are life-threatening, although this isn't too common. For signs and symptoms, we have a fever, rash, vomiting, and aches and pains. These are commonly in the eyes, muscles, and the joints. And bleeding and shock do occur, but these are in the most severe cases. The case fatality rate is 1%, so it equates to about 21,000 worldwide deaths per year, which compared to the amount that is infected, it's not too many. The organism has been known to be lethal, to not be very lethal compared to other pathogenic organisms, and many people do get infected with it, but very few die. Here we see a chart of the symptoms, and we can notice that it is most common for the aches and pains to be in the eyes, muscles, and the joints. For the diagnosis of it, 1 in 4 people get infected will present with symptoms, so that's not too many. There are 3 tests used to diagnose it. These are antibody tests, NS1 antigen tests, and molecular testing in the form of PCR. So Aedes aegypti mosquitoes are the host for this virus. The mosquito has the virus living in its salivary glands. A female mosquito needs to draw human blood to produce her eggs. So as she does this, her salivary glands will transmit the virus to humans. This happens a few days after the bite happens, and high levels of dengue in the blood will be detected. Here we can see the life cycle. So a wild Aedes aegypti mosquito will bite someone who is infected with the virus. So this means that the mosquito is ingesting the blood and therefore ingesting the virus. It takes 10 to 12 days for the virus to incubate in the host. And dengue, if the mosquito is infected with it, it will bite another person and that will infect them. And they'll get the fever in about 4 to 13 days. So there are some groups who are more at risk, and here are some facts about the transmission of the virus. The at-risk groups include travelers, most commonly to Latin America, the Caribbean, Southeast Asia, and other tropical or subtropical regions. And the risk factors include traveling or living in tropical areas. Also, if you have previously been infected with the virus, you are more at risk to having it again. And then for the transmission, this is a vector to human only virus, so only the mosquito can give it to humans. It does not spread from human to human. The only case that this would happen is if an infected mother gives it to her fetus. Here we have a map of states in the USA reporting cases. So clearly you can see we do not have too many cases in the US. Clearly Florida is darker because it is more tropical. and it is very common for travelers. For the treatment of the virus does not have a known cure. It's treated by treating the symptoms and the fever to relieve the pain. This is usually done with pain reliever, and in severe cases, we have to use IV fluids. So, for the management and prevention, we already know that this disease is easily prevented by avoiding the regions in which it is the most prominent. If these regions can't be avoided, you can always wear protective clothing and use insect repellents to keep mosquitoes away. So really controlling the mosquitoes is the key to controlling the virus. And for humans to control this vector, environmental controls are necessary. We control mosquitoes by avoiding standing water and controlling our water sources. Here we have a graphic on preventing mosquito bites when we are traveling to places infected, and that includes bug spray, protective clothing, maybe protective netting over beds. For further information, the CDC has a really great website, and I have linked that here. And here are my works cited. Thank you very much.